Hey friends, I'm Dr. Molly Brinkmann. I'm a veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. Welcome to the Dr. Molly Says podcast. Hello, friends. It is a Monday. Today is Monday. It's feeling very Monday. And here we are. I'm doing a rapid fire Q&A episode today. So we're going to jump right into it. I don't have any kind of profound hot take for you today. So we're just going to jump in. So I posted a question sticker and I've already gotten so many. So I'm going to answer a bunch of these today and then we'll do another one of these in a few weeks. This is just random hodgepodge questions. Some of these questions I have answered in other episodes. So if I have to more detail or a more detailed degree, I will let you know and I'll tell you that we've done it. So let's just get started. This first question is from Everybody Loves Nova. Is the new drug to prolong our dog's life safe to take? It comes out in 2026 from what I hear. Great question. If you haven't heard about this, there is a company coming out with a drug, a medication, oral medication, I believe. I don't know if it's oral or injectable. I don't know a whole lot about it. I know Loyal is the company, and I know that there is a lot of research that's going into this therapeutic. And what I do know is that I know there's longevity studies and different studies that have gone into this product. And the intention is for it to prolong lifespan and I think as well as like quality of life in dogs. I think there's a specific like subset of dogs that it's going to help more than others. I do not know anything for sure. I'm just relaying what I hear in the vet world. I think a big part of it is helping with larger breed dogs who have shorter lifespans. So I think there's a lot of research that's gone into why is that? Is there a way we can help prolong that? And so that's what it's for. So is it safe to take? I don't know. I'm sure it will be if it gets to the market because drugs that are on the market for our pets are safe. And that's why they make it. So once I have more information, I will tell you all more and what I think about it. So speaking of drugs and safe drugs, the next question from Carly Mont is, can you talk about whether you feel Zenrelia is as safe as Apoquel? Which is a great question as well. And if you don't know what this is about, let me tell you. So Zenrelia is a newer medication for dogs on the market. It is a JAK inhibitor. Okay, so that's a class of drug, which explains partly what it does. So it's the same class of drug as Apoquel. Okay, so different drug, same class, same sort of mechanism of action, same intention. And if you've never heard of Apoquel either, these are both medications that are intended to help with the itching and inflammation associated with allergies. It's most effective for dogs with environmental allergies. So dogs with what we call atopy, they're allergic to things in the world around them that we can't really change. And so it helps target part of the inflammatory cascade that makes dogs itchy. And so Apoquel has been around for a long time, several years. It's a very effective drug for a lot of patients. And so Zenrelia is a new JAK inhibitor that's on the market from a different company. And what this question is talking about is when Zenrelia was released, there was a FDA warning put on the label because of one of the several studies that were done, which is part of the normal process to get a drug to market. So in one of the studies that was done, that study was not a required study, by the way, but it's one that was done for Apoquel. And it basically the point of the study was to show that dogs that are on this medication, when they get vaccinated, they still mount a proper immune response to their vaccines to be protected against what the vaccines are protecting them from, basically. And the dogs that were used in that study, turns out their baseline, they were not healthy dogs to start with. So just shortly into the study, the researchers realized that these dogs were riddled with a parasite called coccidia, and that definitely can affect their immune system. There are different complications that happen with the dogs in the study, and it's complicated. We could talk about it for a whole podcast, but basically, this is a good example of something that I think the general public doesn't understand, and there's a lot of misinformation right now, is just that most normal people who don't work in science and medicine, they don't actually know how research works. And that's okay. I wouldn't expect you to necessarily, but they don't understand how much goes into research, even research that's funded by a certain company, because when companies create or come out with new medications, they have to fund the research because they're who is bringing this drug to market, right? Sometimes that gets, I feel like people are like, oh, well, who funded the research? Well, somebody has to fund the research. And so the company that wants to make that drug does fund research. But when they do that, the people, the actual human scientists who are involved in conducting that research are not part of the company. Like they're a third party, and so they don't care about the results. They're just presenting the results in the science. And so that's what happened in this study. So that once they got into the study, turns out these dogs were sick, and at some point there's no going back. You can't say, oh, never mind, we're not doing this study. And so that's what happened. And so the results did not prove that these dogs could be on this medication and have a normal response to their vaccines. And so that's why there's a couple reasons why. There's a label on, or was a label on Zenrelia that said they shouldn't be on this medication for a certain amount of time before they get vaccinated. So that part of that label has now been removed by the FDA because more studies have been done with healthy patients that show otherwise, but it takes a long time for that to get changed with labeling. And so that part of the FDA label has been removed from Zenrelia. So that's sort of the backstory of how do we feel about this. I personally am very comfortable using Zenrelia. I have used it in many patients. There are definitely a subset of my allergic dogs who haven't responded to other allergy medications like Apoquel as well as we want them to. And so we've tried Zenrelia instead, and we've had really great results. And so I'm excited for this drug to be on the market. I'm excited for the label to be getting fixed. I hate that it's a hiccup and has made some people nervous, which is understandable, but I have learned a lot about what actually happened with the study. And so I really understand kind of the backstory. And so I personally am very comfortable using Zenrelia in the same way that I use Apoquel. Again, same class of drug. So any kind of risk factors in my mind, it's the same as Apoquel. So no one, that is just Molly Brinkmann's opinion. But yeah, I use Zenrelia pretty frequently. And I know my dermatologist friends are using it a good bit and are super happy with it as well. And I've had no patients so far on Zenrelia with any concerning side effects or anything. Okay. So the next person, RH Sage 5, said, how to deal with ongoing bladder stones in Shitzu Pug female, both kinds of stones. So I assume this means this dog may have calcium oxalate and struvite bladder stones. We did recently do an episode on bladder stones, so we do a deep dive into that if you want to hear that. But yeah, so bladder stones can be tricky, especially if there are calcium oxalate stones involved, because those stones are really difficult to prevent formation. We still are not really sure why that happens. And so there are different things people do. There are diets, prescription diets that can help prevent especially struvite stone formation. But besides diet, which you should definitely talk to your vet about, I think keeping these dogs with bladder stones really well hydrated is really important. And so as much moisture as you can get in them, whether that's through their actual food, so like a fresh cooked food that's got a higher moisture content is a good idea, or a canned food that can also be mixed or topped on dry kibble if that's what you're feeding. And then just really encouraging water intake, water fountains, things like that. But there are some sort of anecdotal thoughts on ways to help prevent. You could definitely ask your vet about what would make sense for your specific dog. But it's hard. Calcium oxalate stones. Anytime I do a bladder surgery to remove those stones from dogs, I usually tell owners, like, don't be surprised if they come back again. We have to do surgery again, which is a bummer. One day, hopefully, we'll know more and be able to prevent them better. Okay. The next person, Jenna Irwin, said, tips to get a dog to eat. 11-year-old Bernese with nerve issues only eats 1 cup a day. Blood work, ultrasound, x-rays, clean. Okay, so here's the deal. Very often I talk to pet owners, dog owners. This is really about dogs, not cats. Cats are totally different. In dogs. So many times I have this conversation where a dog owner tells me that their dog won't eat. And sometimes they're upfront about it. They're like, they're picky. I can't get them to eat anything consistently. Or they're concerned that their dog's not eating. And so a couple things we talk about when someone tells me that. One, are they sick? So it sounds like this dog maybe has more going on. So we'll talk about that in a second. But just in general, especially like young or middle-aged, healthy adult dogs who are fine. Otherwise, they just they're not eating well. Often what I see is people get in this rhythm of they have gone through all different types of foods. They offer one type of food, whether it's dry kibble, canned, fresh food, whatever, different brands, and their dog will eat it for a few days and then they start to protest it. And so then that pet owner goes and buys a different food. And so then they can get into this cycle where they're like buying a different dog food every 2 weeks. And their dog will eat it when they give it to them. And then in a few days, they quit eating it. I also find that a lot of times pet owners, if their dog doesn't eat a meal that they put down for them, then they'll give them snacks because they didn't eat. So they'll get treats or, human food, other things. And so when I'm sure that this patient is healthy, I don't find any signs of pain. Pain can be a subtle sign of pain can be decreased appetite. So we want to make sure that's not what's going on. We just talk about how you control what your dog eats. And if you teach your dog that if they stop eating what you offer them, that then they're going to give them treats or snacks, human food, or switch their food, then our dogs are not stupid and they figure this out. And so they know, well, if I just skip a meal or two, I'm going to get something fun and more exciting. And also dogs are not thinking about their health or their body weight. And so if you offer a dog, a food that they maybe think is not that exciting, but then you offer them treats or human food when they don't eat that, the treats are a lot more fun, right? It's kind of like most people, if you put a kale salad and a nice piece of pizza in front of them and you were like, calories aren't a thing, pick which one you want to eat. Most humans are going to pick the pizza, right? And if they eat pizza all day, then if you give them a kale salad at dinner again, they probably don't want to eat the kale salad because they're probably full from eating that yummy, greasy pizza, right? So dogs are the same. And so a lot of the time, a little bit of tough love is how we get back into getting our dogs in a routine of eating. And so I usually encourage people not to change their food all the time. We want dogs to like what they eat, and so if people can afford to do a fresh, cooked, balanced food, I think that's a great option for picky dogs. A lot of picky dogs would love to eat fresh, cooked food. You just have to make sure it's formulated by a nutritionist and done the right way. But for a lot of people, that's not feasible. And so sometimes adding toppers that are balanced as well helps, but then you don't want to fall into the trap of dogs only eating the kibble or only eating the topper and avoiding the kibble. So there are some situations where an owner needs to feed kibble and the dog is just being really picky. And so I just tell them at some point we have to just offer them what we know is healthy and safe and affordable for them to eat. And you put it down, you take it up in 30 minutes, and if they don't eat it, then they're intermittently fasting that day. And then they get dinner offered to them. And if they don't eat their dinner, then it comes back up. And then we wait and we try again at breakfast the next day. And so some of these dogs have to fast for a day or two to learn that if I don't eat the food that's offered to me, I'm not going to get anything else. And in a healthy dog, that should not be a problem. Obviously, you want to make sure your vet agrees that they're safe to do that. But sometimes that just is the case. Now, in a dog like this one who has nerve issues, even though blood work and everything looks okay, my concern here would be pain. Does this dog have signs of pain? Do we have arthritis somewhere? Have we done a good exam to find a source of pain? Sometimes even in these dogs where I suspect maybe pain's involved, we'll do a trial with some pain meds to see if their appetite and other things get better. So definitely sounds like something we should be chatting with our vet about. Could there be some pain? Okay, next question is from one of my longtime followers, Finley Potamus. Is there merit in spaying dachshunds later to decrease IVDD risk? This is a hot topic in dachshund groups. Another great question. And this is a very gray area in vet med right now, which I have done an episode about this timing of spay and neuter, but I didn't have time to get into like a lot of different breed details. So one day when we talk about dachshunds, we can cover this more. But the question really is, does spaying or neutering a dachshund at a certain time point make their risk of developing IVDD greater or lower? And the real answer based on the science is we don't really know. There is some evidence that there may be some protective benefit to waiting until a year old to spay and neuter dachshunds as far as IVDD. Meaning, there may be an association with spaying or neutering dachshunds under 12 months and a higher risk of developing IVDD. Now, it's important to know that just dachshunds as a breed are the poster children of intervertebral disc disease. So being a dachshund makes it more likely for them to have IVDD. But we don't want to add to that risk by neutering or spaying them too young. But at the same time, there are other reasons why going ahead and spaying and neutering these dogs may be beneficial around 6 months, which has been the norm, especially in females, because dachshunds are also a breed who we do see get mammary cancer. And so there is some protection against mammary cancer if we spay females before their first or second and third, less there, but heat cycle. So I would be more inclined to consider waiting in a male dachshund until 12 months. But I also think it's fair to say we want to wait until a year to spay a female dachshund. You want to make sure there's no risk of that female accidentally getting pregnant or a male accidentally impregnating another dog or, the ability for them to run away. But yeah, so the answer is it's a gray area and we're not sure exactly, but there may be some benefit to waiting, but both answers are right and okay. I would not spay or neuter a dog any sooner than 6 months old in any breed if I could help it. Now, rescues and shelters do that sometimes, but any breed, I would try to wait till at least 6 months, at least if we can. Okay, I love this question. Mary Jane Little, or Lytle, I don't know how you say it, asked when to do full blood panel, what testing should be done at what ages in dogs. Great question. So I am a big proponent of routine baseline monitoring lab work in our patients, dogs and cats. She asked about dogs, but we're going to talk about both. So typically we spay and neuter dogs and cats anywhere from 6 months to 2 years of age, right? Depending on their breed and size, et cetera. And so usually or ideally, we're going to run some blood work before we put them under anesthesia for that. I think that's a good idea. And so often that's our baseline blood work. And that's going to cover some basics. So CBC, blood cell counts, and then a chemistry, kidney values, liver values, protein, some electrolytes, few different random values. And that's just to make sure, especially in a young dog, our kidney function's normal, liver function's normal, blood cell counts are normal. We do pick up sometimes on some issues on that blood work. It's rare. So most of the time when we do blood work in young, healthy dogs and cats, it's normal. I see some chatter online sometimes. Especially I posted about things I would want a clinic to do before they put my pet under anesthesia, and I included blood work. And I had some people sort of disagree with that and say that even people in vet med, that young, healthy dogs, their anesthetic risk isn't higher without blood work. And that's true to a certain degree, but I think it's a great opportunity to get a baseline on blood work. I have absolutely caught some kidney and liver, especially issues in young dogs. A lot of them were like congenital. They were born with that problem by doing blood work before spay neuter. So I think some baseline blood work anywhere from between birth and like 2 to 3 years is great and important. And then you should be having your dog or your cat examined by a veterinarian at least once a year. And so typically, anytime I see a pet for an annual wellness, no matter what their age is, I'm going to give owners the opportunity or the option to run blood work. I think baseline, at least by the age of 3, sooner is even better, is really important. And then every year, obviously, is ideal to monitor that. A lot can change in a year. If cost is an issue, while they're younger, I think every other year is still fair. And then depending on the breed and size of the dog determines kind of the age that I would say it's a lot more important, or we might bump up what we're monitoring. And so if you don't know this, larger breed dogs, their biological age is higher typically than their chronological age. Meaning, if you look at like a Chihuahua, little small breed dog, and then a Bernese Mountain Dog, large to giant breed dog, a 5-year-old Bernese Mountain Dog and a 5-year-old Chihuahua are really in different stages of their biological life. Okay. Big dogs age faster. So different physiological processes are going to slow down and have issues typically sooner in large breed dogs than in small breed dogs. So a 5-year-old Bernese Mountain Dog is more likely to be developing diseases that can come with age than a 5-year-old Chihuahua. And so I typically start recommending more involved and more regular blood work in large breed dogs at a younger age. So anywhere from like 5 to 8. Then we start talking about, okay, maybe we bump up what we're monitoring and maybe make sure we're doing that every year. And adding a thyroid panel, I think, is always a good idea. And then a more thorough chemistry panel. A lot of this has to do with the lab companies that we use. And then a urinalysis, I think, is something important to really be monitoring. Is there protein in the urine? Is the urine concentrated? Things like that. And then at some age, we do now have some blood cancer screening tests that I think can be a good addition to wellness screenings. And again, in larger breed dogs, that's going to be a younger age than in smaller breed dogs that I think it becomes a lot more relevant. So large to giant breed dogs, I would say 5 to 8, we really should start doing those things. The larger the dog, the younger we probably should do them. And then in smaller breed dogs, like under 40, 50 pounds, I think annual blood work is a good idea, and then bumping up how involved that is around the age, more like starting around 7, 8 to 10. And cats kind of fall in the smaller dog category. So blood work in cats is a really good idea from a young age, and then definitely bumping up what that involves between the ages of 8 to 10. A lot of cats get kidney disease as they age, and so the earlier we can identify that, the better we can sort of manage that and hopefully prolong the worsening of that. So I hope that answers that question. And then also in our bigger breed dogs, especially that are more prone to cancers like hemangiosarcoma, which I've talked about here, in addition to the blood cancer screening tests like the Nu-Q, which I've talked about, I do think some screening imaging is a good idea. So x-rays of the abdomen especially, and then ultrasound of the abdomen can catch tumors in the spleen or the liver changes sooner than a lot of other things. So that's something else to chat with your vet about around that age, like 5 to 8. Okay, Rogie Pogie asked, is there any way to prevent ACL tears? Okay, I did do an episode on ACL or CCL tears, so cranial cruciate ligament tears in dogs. Cats can do this too, a lot less common. So that is like the ACL in people. So it's a ligament in the knee of dogs and cats. And there are a lot of dogs that tear their CCLs. I assume it's the most common orthopedic injury we see in our patients. And so here's what I'll tell you about preventing a CCL tear. The number one thing you can do for your dog and your cat to prevent orthopedic issues is keep them at a healthy body weight, body condition, and give them the opportunity to have routine exercise so that they maintain excellent muscle mass. And there is lots of research and evidence that shows that maintaining proper body weight and body condition can prevent a lot of orthopedic injury. Now, there are definitely anatomical conformational factors when it comes to a lot of orthopedic injuries. So CCL tears, sometimes just the way that dog's structure, legs, knees, hips are put together makes them a lot more prone to tearing their CCLs. But if they have conformation that makes them more at risk for that, plus they're overweight, then it's going to happen. And so I would say regular exercise to maintain good muscle mass and keeping your dog at a ideal body condition, which would be 4 or 5 out of 9. If you don't know what that means, you should ask your vet about it. But always ask your vet, how's my dog's weight? How's their body condition? How do you feel about their muscle mass? How much should we weigh? What's the ideal weight? That is the most important thing. Okay, yesterday was World Rabies Day. And so this is a great question. Laura Ollinger said, what is the standard protocol when a human is bitten by a dog that is not vaccinated for rabies? So dog or cat, this applies to, or any other mammal for that matter. This is why you should not try to interact with wild animals. So there are different protocols to some degree in different states. Okay. So if an animal, a dog, we'll talk about dogs and cats. If a dog or a cat bites someone and they're not vaccinated for rabies, or we don't know, and they're a stray, or we don't have a record of their last rabies vaccination, we don't know if that dog or cat was protected from rabies. So there's a possibility that animal could be infected with rabies. And when they bite a human, that could pass along rabies to the human. But it can take time for the symptoms of rabies to appear both in that animal and in the human. Now, it is very rare for a dog or a cat to be infected with rabies and then happen to bite a human to possibly infect them. That is rare. So all the people who talk about or who are like anti-vaccinations for dogs and they want you to think that the rabies vaccine is so bad for your pets and they don't want you to vaccinate for rabies, they may say like, oh, this is so rare. And yeah, it is. But rabies is not treatable once neurologic symptoms start. And so rabies is something like you don't mess with rabies. We cannot just like, oh, well, probably okay. Like you can't think that way about rabies. And I'll tell you a story of why, and all vets have one of these. But when I was in vet school, there was a horse in the equine hospital that was sick at first, just kind of sick. And then it became neurologic after like a week or two of people handling this horse. Turns out the horse had rabies, and all these vet students had handled this horse. So many people in the hospital had. And so everyone that had handled the horse, if they weren't vaccinated for rabies, which a lot of vet students are, then they had to go through treatment to prevent contraction of rabies. And so it does happen. This happens in animals too. I'm in a group of human and veterinary doctors on Facebook, and I recently saw a post. Someone's sister who was pregnant was bit by their dog who had not ever been vaccinated for rabies. And then that's a real pickle of a situation, right? Especially because the human was pregnant. So it's very important. And then while I'm talking about this, just so you know, rabies titers, which measure antibodies that are consistent with the rabies vaccine, Titers do not show the whole picture. And there's, in most states, I don't know that there's any states that recognize like a legal titer level. So rabies titers do not prove that that pet is protected from rabies, especially in the eyes of the law. And so if a dog who's not vaccinated for rabies bites a human, even if titers have been done in most places in the U.S., that doesn't count. And so the same protocol that we would use for an unvaccinated is used for that also unvaccinated dog, even though they had a titer done. And then again, another example, just last week, I saw a cat, and this should have been my hot take, but I saw a cat who was like a outdoor neighborhood roaming cat who's technically owned by someone who's just kind of generally lethargic and sick, and they brought it in and dropped it off. And this cat seemed sick, but was also real spicy and wanted to eat us, and had not been vaccinated for rabies in like 12 years. And so that's a difficult situation because I have to keep our staff safe, right? Because this cat wants to bite us. So we would need to sedate this cat to do anything in order to be safe. And the owner seemed to be like confused about the concern and asked, can we just run a rabies titer? And I know that comes from some video or something they saw online about how rabies vaccines are unnecessary. So yeah, if you have an outdoor cat who just roams your neighborhood, if you're the owner of that cat, it's your responsibility to get that cat vaccinated for, if nothing else, rabies, but absolutely it needs to be vaccinated for a lot of other things. But rabies especially, because really that puts your entire neighborhood of people and children at risk if you have an unvaccinated cat roaming around. Feral cats are a very big source of rabies in the world and other places where they're not required to vaccinate their pets. And so unvaccinated cats roaming around in neighborhoods anywhere in the U.S. Can definitely be a big risk factor for rabies. Okay, off my soapbox. So the protocol, if a human is bit by a dog or a cat who's not vaccinated for rabies, what happens is that bite should be reported to local, like animal control or health department, whatever authority in your state gets involved, or your county. And there's going to be paperwork. So that pet needs to at least in Tennessee, that pet needs to be evaluated to make sure there's no sign of any illness initially at the time of the bite. And then that pet needs to be quarantined for 10 days. Now, depending on your state, there are different rules. If the pet is well when they're initially examined, then they can usually be quarantined at home. But this is like kind of honor code. The owners of that dog have to be compliant. So the dog should stay at home. It should have minimal contact with anyone or anything. And then 10 days later, that dog or cat is reevaluated by the same vet to make sure still no signs of any illness at all. And if they go for those 10 days after the bite without any sign of illness, then we should be safe. The tricky part is if that pet, dog or cat, starts to get ill during that time frame, there are situations where the risk of rabies is high enough that euthanasia can be recommended of that pet so that rabies testing can be done. And a lot of times the reason for that recommendation, and this is a case-by-case situation, but the reason for that recommendation is obviously the life of the human that was bitten is important as well. And so knowing if that pet has rabies is obviously really important. There are situations where a human can receive prophylaxis for rabies. We call that post-exposure prophylaxis. So there are injections and vaccination. But it can get really tricky, especially if that dog or cat just happens to get sick during that 10-day quarantine. So at the end of the day, we should just not deal with that at all, right? We should just vaccinate our pets for rabies. But if you're a human who gets bit by a dog or a cat ever, hear me now. Find out if that pet is vaccinated for rabies, and don't just go by what the person said, oh yeah, they're up to date. You need to see a rabies certificate. You need to see when it expires. You need proof that that pet was vaccinated and they're up to date. And any kind of bite that breaks the skin, especially, you really need to get that evaluated by a medical professional, and that really does need to be reported to health department or animal control or whoever that is. Okay, I have answered questions now for 35 minutes, and I only got through a few of them. But I like doing this. I like the random hodgepodge of questions. So we'll just keep plugging away at these questions in subsequent Q&A episodes. But let me know what you think. Do you like this? It can be random. You just never know what you're going to hear when you listen. I think that's personally kind of fun. So if you have more questions, hop on my profile, send me questions, Dr. Molly Says or Dr. Molly Says Pod. Feel free to DM me questions. We also have a link in the bio of Dr. Molly Says Pod where you can submit questions. So I hope you all have a wonderful week, and I will see you next week on the Dr. Molly Says podcast.